We're ready to talk about anger. Let's talk about anger. Resisting and suppressing anger can actually trigger neuroplastic pain and mind-body concerns. And in this video, I'm going to explain why this is and how we can move through anger with a sense of safety. So, let's get into it. Several researchers and doctors have discovered that resisting and suppressing anger can actually trigger real pain symptoms. Dr. Sarno discussed how unconscious rage was really responsible for mind-body concerns, basically meaning that rage or anger that we're not fully aware of or conscious of is triggering our symptoms. And he helped thousands of people by allowing them to get in touch with their anger or their difficult emotions and having them release it and express it. Dr. Schubiner has also talked about how resisting important emotions, such as anger, can trigger inhibiting symptoms like pain, fatigue, anxiety, or depression. Now, I recently did a video on Dr. Schubiner and Dr. Lumley's triangle model of stress and symptoms, which I'll link to the top here, and I highly suggest you check out, because it explains why resisting important emotions can trigger real symptoms. Part of the way we heal from neuroplastic pain or mind-body concerns is actually learning to feel, experience, express, and release our anger. And a frequent question that I'll get in the comment section is, how do I feel my emotions? Hence why I'm making this video, because feeling our emotions is a bit abstract. So I'll try to give you a structured technique that can help you move through your anger. One technique that I'll often use comes from Kristin Neff and Christopher Germer, who are two amazing researchers who heavily focus on self-compassion. See, it's my belief that if you're gonna go on this journey of learning to feel deep, dark emotions, we need to do it with an element of self-compassion. Because self-compassion has an amazing ability to actually help us feel safe in our nervous system, in our body. And so what I'll see people do, and this is a big mistake, is people will start to feel their emotions, but they won't do it with kindness or an element of self-compassion. And so their brain and nervous system just feels more in danger then, and then it triggers more pain or symptoms. And so when we're doing this work, when we're feeling our emotions, when we're diving in deep, we need to do it with self-compassion because it will create a sense of safety. And I always recommend, if you're on this journey, it can be really helpful to find a good therapist to work with who can guide you through this. So I'll briefly explain this exercise, which is called meeting anger with mindfulness and self-compassion. Firstly, you want to spend time validating your anger instead of criticizing yourself for it. Remember, anger is a normal human emotion to feel, and it's actually really useful. Anger can be useful because it tells us if someone's crossed our boundaries. It can give us needed energy to motivate ourselves and protect ourselves. It can also protect other people from endangering themselves, like say a child was putting themselves in danger. And it can also allow ourselves to be a full, messy, emotional being. So when we first become aware that we're feeling anger, we need to allow ourselves to drop into our body, explore it, while spending time validating it, and reminding ourselves that this is normal to feel and other people would feel this way. Secondly, we need to explore somatically if there's softer feelings underneath the anger. A lot of times anger protects us from feeling softer emotions like sadness, hurt, fear, guilt, or shame. Really allow yourself to connect with your body and see if underneath the hard shell of anger, there are these softer feelings. And then spend time actually approaching them and exploring them. And you can even breathe into them, give them a little bit of warm air, and allow them to take place as you just float alongside them. Thirdly, Neff and Germer explain that we need to see if underneath the softer feelings are unmet needs, such as a need to be loved, known, seen, heard, connected, or validated. See, all of these are universal needs that we all have, that we all need in our lives. And it's really important that underneath the anger and the softer feelings, that we connect with that unmet need so that we can then provide it to ourselves. Then the final step is actually giving ourselves compassion for the anger and softer feelings that we're having. And a simple way that I like to do this is just identifying where in your body you're feeling the discomfort. Like say I was feeling tension or pressure on my chest. And what you could do is you could place both hands just on the area where you're feeling the discomfort and just feel the warmth and weight of your hand as you just breathe nice warm air into the area. And by doing this, we're just softening and soothing how we're feeling in our body. And it signals to our brain that we're truly just taking time to care for ourselves. And then you can say a few kind things to yourself that you may need to hear, such as, may I be kind to myself, may I love myself, or may I belong. And doing this, maybe for a few minutes or an extended period of time, helps create a sense of safety as we're feeling anger and difficult emotions, and helps us move through it. So I hope this video was helpful and helps you understand a way that we can move through our anger with a sense of safety. So please put your questions or comments down below, hit the like button, and subscribe to my channel, and I'll see you all next time. Take care. Several, I can't say that word. Several. Am I saying it right? Several researchers, I can't say the word. And a frequent question that I'll get in the comment section, man, I can't say comment section, comment. Sounds like you're saying comment.